So just quickly with my last video, I've already I've already mixed things up, um, especially with the rule of nines. It's completely fucked that up. That shows learning, doesn't it? That really shows learning. Two things. First of all, the rules of nine and the chemical burns. With the chemical burns, how I said prolonged irrigation with tap water, you've got to make sure this is sterile, obviously, and obviously the most sterile kind of liquid that we have on the ambulance that we can use is normal saline. So that's fine. If we just, not in the back of the ambulance, could make a mess. But you wanna really get some normal saline or anything and just cool them down. There is a maximum time that you can really have to irrigate for, because after a while you're just gonna cause more problems. The rule of nine. How I said that the different percentages, just to go over, you got faces, front of your face is 4.5, the back is 4.5. Like I said with the arms, that's the same. 4.5, back is 4.5, 4.5 in the front, 4.5 in the back, so both your arms equal 9%. So I said your abdo region is 9%, but it's not, it's 18%. So your front of your body, above your groin, cutting off your arms, this part of your body here is 18%, and same with your back. Then you've got your groin, which is 1%, and your ass doesn't count because that's still a part of the back. And then your front of your leg is 9%. Back of your leg's 9% because it's much larger than the arm. Front of the leg is 9%. Back of the leg is 9% as well. So just quickly, that there is the rule of nines. And you've really got to get that down packed because you can work out the percentage of the burn. And obviously, if they've just burnt their arm, you can divide that 4.5. If they've just burnt their hand, you can divide that 4.5% up to what the front of the hand could be. Or if it's the entire hand, divide 18 by what, maybe... Divide 18 by 3 or 4? I don't know, something like that. I'm just a student. Alright, so when you burned, you've got this thing called, excuse my pronunciation, because rhabdomyolysis. So what this is a breakdown of muscle fibres, and with the breakdown of the muscle fibres, it leads to the release of myoglobin into the bloodstream. Now, you've got to know this because all burns that break down the muscle fibres are going to have the release of myoglobin into the bloodstream, and this doesn't get filtered by the kidneys, and this can cause damage to kidney cells. So that's just something to be aware of with all burns patients, which, the worst one's obviously going to have more problems with this, but that's just something just to remember. So with the management, you get the management of these patients that have been burnt. Cooling is the key to this. Tap water for greater than 20 minutes. It's effective. It's about 3 hours post the burn. So after 3 hours after they've burnt themselves, doesn't really become effective as much as it initially would be. And like I said, normal saline is something that we can also use. We want to remove constrictive objects. So if they've got a jacket on and they've burnt all up their arms some bloody way, because it does happen. You have patients that just really screw with your management. Got to cut that off. Get rid of it. Hydrogel dressing. But this is just used for a short period of time, because the problems with this gel is that it actually can act as an insulator and start to warm up your body, and it can cause burns. Funnily enough, I suppose it's just a side effect. Cling wrap if the skin back to normal. So you wanna cling wrap the burns, but don't wrap around because you're gonna bloody suffocate the cells. I don't know if that's that's the first thing. Probably not. Don't write that. You want to get the Glad wrap and just pretty much just lay it up this way, but don't wrap it around. So fluid, you're allowed to give fluid. It's indicated to give fluid if you've got 15% total body surface area, and you use the rule of nines to determine what is 15%. Obviously, so front of your face, 4.5%. You don't give it. If you've got your entire arm, which is 9%, yeah, you still don't have to give fluid. If they've got both their arms, that's 18%, you can give fluid then. This is indicated at 4 mils per kilo per percentage of burns over 24 hours, and you want to give the first, whatever this is Ambulance Victoria guideline, this is what we do, but we're being taught a universal approach. So with that guideline, 4 mils per kilo per percentage of burn over 24 hours, you give your, whatever that number is, you give that first half in 8 hours. So then you have to determine what that's going to be. Obviously, you've got to work it out. But that's an Ambulance Victoria guideline. If you're watching, like, if this is in the United States or anything like it, it's going to be completely different. It's just what their evidence has suggested and what we've found. The way we've been taught is actually give boluses of 250 mils of fluid. The reasoning behind this is, well, two main things. First of all, the lecturer wants us to be, a universal approach, give 250 mils. And second of all, there's actually increased evidence. We did an assignment. There's increased evidence to say that aggressive fluid resuscitation in the hypertensive patient that's, for example, it's been burnt or stabbed, is actually a bad thing because you've got all this blood loss, or the burn. You've got potentially you can over fluid resusc them, or you can pop the clot, or you can dilute the clotting factor. It's just. We wrote an essay. I can link it to. I don't know. And with the pediatric or elderly, obviously, if they have to be treated differently. If they've got 10% or greater, fluid is indicated. So, for example, their entire full up their arm and a bit into here, I would say it's 10%, even though it says 9. But if you just got to work it out, like if 9, 10%, it's pretty much the same thing. If you're looking down just one side of the arm, you don't give them fluid because they don't need it. You just manage them the way I said, with the cooling, with the gel, and with the Glad wrap. And obviously with pain relief. So you've got, so that's just pretty much the management of that. And obviously frequent reassessment every 15 minutes, which is what we've written down, but obviously things are different. But in terms of the Victorian paramedic, that's apparently what we got to do.